Hey there, this is Dr. Matt Joosse at Joosse Family Orthodontics. Try as we might, not every outcome is always perfect. And here's an example of an imperfection and what we can try to do about it. So on the left, you'll see what somebody's teeth look like when we took braces off. And on the right, you'll see what we did after a little treatment of those teeth. So if we look at the left, you might notice that there's some white marks on these front teeth. Like there's a line running across the front teeth and a line running across the front teeth there. And those lines are essentially decalcification. So it's where the tooth has changed colors and gotten whiter, but that whiter is actually part of a process towards a cavity. And it's because of poor oral hygiene when the braces were on. If you look beyond those front two teeth at the next two teeth, you'll see some white marks down around the gum lines. And then if you look at the next teeth, you'll see more white marks along the gum lines. In fact, over here on the left side, there's actually a little cavity, a little hole that formed on that tooth. And this is a result of poor oral hygiene during braces treatment. And the white lines are essentially where the worst hygiene was, but it's kind of surrounds where the brace was. Where the brace was is protecting the tooth, so there's no damage underneath the braces. It's just damage around the braces from always having plaque and food and bacteria on the tooth in those places. So occasionally this happens when we finish. We have some white marks on teeth, and occasionally it's pretty noticeable, like it is in this case right here. And so if you look over at the right side, we have a treatment for this now, and it's a resin infiltration. So you're not cutting away any of the tooth, but what you're doing is you're trying to take that decalcified area and you're trying to infiltrate some resin or kind of some like liquid filling material, if you will, kind of like into that decalcification. And you'll see if you look at the front teeth over on the right, this is literally, these pictures were taken 15 minutes apart. And so over on the right side, we made those decalcifications disappear on the front two teeth. On the next two teeth, we made them get a little bit less noticeable. And then on the third teeth, it got a little less noticeable on the right side. On the left side, I can't take away a cavity with this stuff. So that would require a filling from the general dentist, and then that will be kind of restored and will be looking better. I think by the time that that's restored, you really wouldn't look at this and notice that there were decalcifications. But it certainly is an unfortunate consequence of treatment, and I just wanted to educate people that there is something that we can do about that, and so we can go through this kind of treatment when we're done, and it can make these what we call white spot lesions or decalcifications, we can make them go away. So if you have any questions about how to do that, or if you're in need of that for somebody that you know and love, just ask us, and we'll let you know what the details are. Okay.